Hello, I'm Dr. Brant Gibson, and tonight I want to talk to you about autonomic neuropathy and how it can be diagnosed. So, just a quick reminder, autonomic neuropathy is one of the types of peripheral neuropathy that you can run into. So, if you remember, the peripheral nervous system is everything outside the brain and spinal cord, which includes the sensory nerves or large fiber sensory neuropathy, small fiber sensory neuropathy, motor nerves, motor neuropathy, and the autonomic nerves or autonomic neuropathy. Autonomic neuropathy is a neuropathy in the nervous system or the portion of the nervous system, peripheral nervous system, that causes the automatic functions to the body, including uh, expansion, contraction of blood vessels, including the functioning of the intestine, the functioning of the stomach, the functioning of vision, like the pupils dilating and contracting, the sexual function, the sweating and oils released to the skin, and those kind of things. So basically, it's mostly automatic functions of the body are controlled by this system. That therefore, it is very important that it get diagnosed and that you determine how it is done. So the best way to diagnose peripheral neuropathy of the autonomic nervous system or autonomic neuropathy is through one of two tests, or you can actually do both. The most common that is done is QSART, which stands for Quantitative Pseudomotor Axon Reflex Test. This is a very common test, and it causes basically what it is. It's a electrical stimulation that causes the sweat glands to respond to stimulus. And so what happens is it's testing that response and measures the sweat released from the skin to determine the autoimmune control. So how well the autonomic nervous system is working. And in multiple cases, this can actually diagnose very, very specifically for autonomic neuropathy. The other is a pseudomotor testing, which measures the pseudomotor reaction to an electrical current. Basically, what it's testing, as opposed to the sweat from the QSART, it's testing the chlorine ion release to determine how well the pseudomotor muscles in the skin are actually functioning. Again, testing the autonomic nervous system. In both cases, you can actually determine the extent of autonomic neuropathy from normal to severe decrease, and it can be a pretty significant problem, pretty significant confirmation that you have an autonomic neuropathy. So the idea is through these tests, I guess I should tell you a little bit. So how are these tests done? The easiest way to do both of these tests is through a simple system that uses electrical currents, where you actually place your hands on what looks like a mirror, you put your feet on what looks like a mirror, and it sends a series of electrical currents and then measures the response of the body to these currents to say, okay, are we getting the normal expected autonomic response, or are we not getting that response? And so it can determine the extent of your autonomic neuropathy. And by doing this, you can confirm that there is an autonomic neuropathy, and then you can talk about, okay, if this is one of the types of peripheral neuropathy that I have, what do I need to treat it? So this is Dr. Brant Gibson. This is your Neuropathy Nugget Day 227. Autonomic neuropathy and how you diagnose it. If you would like additional information, you can go to Dr. Brant Gibson, www.drbrantgibson.com/bootcamp to get additional information and to go into pretty significant evaluation so you can actually determine, do you have autonomic neuropathy? Do you have small fiber or large fiber sensory neuropathy? And do you have motor neuropathy? Really, what types of peripheral neuropathy do you have? This is Dr. Brant Gibson. Have a great rest of your night.